Okay, so healthcare companies are some of the richest companies on the face of the planet Earth. We know this. When Obamacare passed, my health insurance went from around $150 a month for 5 people in my family to $400 a month. That's at my job, Southwest, as a flight attendant, with coverage. $400 a month for my family, and that's supposedly a good deal. Meanwhile, you can hop inside of a car, kill a human being, an insurance company will cover you. And some people are paying as little as $30 a month for that kind of coverage. You're talking $1 million in worth of liability. Most of us will never use $1 million worth of healthcare services, but we're paying 10 times as much as we would for car insurance that gives you around the same amount of coverage dollar-wise. It's ridiculous. We're gonna dive into this topic right now. I'm Maximilian, and you have tuned into Solutions. Welcome. Imagine going to the grocery store, grabbing your loaf of bread, bringing it home, and then being told, oh, that loaf of bread that you got a month later when you get the bill, the actual price for the bread is buried in 5 pages of numbers with no identifiable markers towards what you actually purchased from the store. And then the price underneath that unidentifiable 12-digit number for whatever service they've buried it under is $20 for a loaf of bread. I'm saying $20, but for something as simple as a shot, it could run you $500. How come they're allowed to charge us without telling us what the price is for their services? We don't do anything like that. Solution number one, right out the gate. Don't let them just make up a price and charge us. Make them post their prices for everything like everyone else. That's just a simple solution. And here's the reason. They don't have any competition. They don't have any competition. Some states have one healthcare provider, one. Some states have 5 healthcare providers. They can charge whatever they feel like charging. That's ridiculous. They shouldn't be allowed to charge just whatever they feel like charging. But they can because they don't have anyone to stop them. They literally made it illegal for you, a healthy individual who stays active, who doesn't smoke, who eats reasonably well, in shape, great medical reports, never had any sicknesses. You're the same as the person who doesn't exercise, on their couch, smoking, doing drugs. You're both the same. You're both the same. That's not fair. You shouldn't have to pay for the person that's doing nothing. You should be able to get your insurance from wherever you want. Look at the Constitution. The Constitution of the United States is not very many pages, and we've done pretty well with it. You can get this solution from one sentence. Make healthcare portable. If you move to a state, if you're from Oregon, if you're from Texas, if you're from Minnesota, you're from New York, you should be able to get healthcare from wherever you want, even online. Imagine if instead of one healthcare provider, there's 100. Other expensive things that we purchase that there's lots of options for. Cars. Cars are a very expensive purchase. Houses, real estate agents, all over the place from anywhere you want. But for some reason, we've allowed, and I stress that, we have allowed these people to tell us, no, here's what the price of a straw is, something absorbent. Here's what the price of an ambulance ride is, something absorbent. Never up front, always a month later, buried in a bunch of code that no one could understand. It's not designed for you to understand it. Why would they do that? It's not beneficial for them. They can charge you whatever they feel like charging you. Once again, the solution is very, very simple. allow people to get healthcare from wherever they want and whoever, online. Imagine the ad would go something like this. Are you in your 20s to 30s, don't smoke, are willing to take a medical exam? We have a $50 a month healthcare plan for you, just like Geico. And then, just like Geico, State Farm, E-Insurance, or Allstate, you can layer services to your heart's desire. If you want more coverage, you can layer up. If you want less services, you can layer down. But competition will bring in a base level of quality, just like with car companies. If Geico doesn't give you enough coverage, you'll see an Allstate commercial that says, is your cut rate insurance, you know they're talking about Geico when they say that, gonna cover you from mayhem like me? And they show a guy with lying on the top of a snow-filled ceiling, falling through it, and saying, if you've got that cut rate insurance, it may not cover you for something like this. They show a thief breaking into your car and smashing your window and saying, hey, is your cut rate insurance gonna save you from mayhem like me? And you go, oh man, maybe I should pay the $10 extra a month and get some more coverage. Healthcare could be the exact same way. The sad part about it is I don't hear any of our candidates talking about it. None of them. None of them are talking about that. They're talking about having the government take over healthcare. I would like to see the government take over roads and bridges. They're seeming to have a problem with that. Their basic jobs. I would like to see the government take over schools. They're still having a problem with that. Live in a rich neighborhood, school gets lots of money. Live in a poor neighborhood, school doesn't get as much money because the tax revenues are based off of the income coming from the neighborhood around it. That's kind of not a good plan. If you live in a poor neighborhood, school doesn't get much money. I would like to see the government take care of its postal service problem, which is continuously running a billions of dollars in deficit every year because it's not ran well. Everything that the government touches in full with no competition except for the government isn't well. Because when you don't have competition, you don't get quality. You have to have competition in order to have quality, ladies and gentlemen. So, even with the government, look at the VA hospitals. The government doesn't have any hospitals. So even if the government does take over all of healthcare, it's just gonna be the same insurance companies charging you. And not only are they gonna charge you, then they're gonna be like, oh, well, we just added 30 million more Americans, so now we have to charge even more because we have more expensive. We have 30 million more people that we're all covering now. Yeah, right, Bill? Yeah, right, Bob. Right, Buford? Oh, yeah, Mortimer. Yeah. Competition will put these fools out of business. Competition will make quality rise. But until we wake up and demand it, it ain't gonna happen. So, the healthy person pays for the person who's not healthy. The active person pays for the person who's not active. It's not right, it's not fair, and it absolutely doesn't make sense. The healthcare company charges whatever they feel like charging. And they're charging whatever they feel like charging because we've allowed it, and they can. And they're gonna continue to do so. So from this point on, demand that your politicians start talking about making healthcare available from any state and any place that you want to. You'll see people from overseas offering healthcare plans for you. And then you could just go in and visit your regular hospital and they will cover you. Just like how you do car insurance. You can get your car fixed anywhere when you have a car accident, and they just go and they contact the insurance company and the insurance company pays for it. The same thing could be for healthcare. They've just tried to make it complicated and huge and told us that we need to have the government step in and take over everything when the government's not even taking care of the roads and the bridges and the streams and the police department. It has enough issues on its own. Money is bleeding out of every single hole in the bucket you can think of with the government. We don't need to give them any more dollars. What we need is to introduce competition and make it so that you can get healthcare anywhere you want to. So finally, I know I've said it 5 times, solution. Get healthcare from anywhere you want. One sentence, not 2,500 pages of a pork-infested bill that only made my health insurance go from $150 a month to $400. Thank you for subscribing, ladies and gentlemen. My name is Maximilian, and that's your solution today for the healthcare problem.